Hi, I'm Jane Watson and this is our third instalment of our interview with Dr Parag Telang. So, let's get back to some questions. I know you do cosmetic procedures during FFS. They're not technically part of FFS, these so-called beautification. How do you incorporate them with your FFS and why?
The beautification is an ongoing process. Get a lot of patients who need more volume on their cheeks, more volume in the nasolabial fold. It's basically got to do with volumization of the mid-face. So when we talk of the mid-face, it has to have more anterior projection. So to give more anterior projection, so either you can go for something called as cheek implants, which are made of silicone and they are permanent, they are inserted from inside the upper lip, or you can go for fat fillers. Now, I personally believe fat filler is more unpredictable. In some people, it lasts for a longer time. Some people, it sometimes reduces in size in 4-5 years' time. So, you might need a little touch-up if you go for fat, but can be done.
Fat transfer can be used for other stuff as well. What about the deep creases in a forehead, or the nobular folds, or the lines?
See, basically fat is like a filler. So any area of the face where you have deep creases or where you have something called as a permanent wrinkle, you can always fill up these lines using your own fat.
Would you prefer fat than artificial fillers?
It's an individual thing. See, if you are going to need a lot of volume on the face, then individual fillers will work out to be very expensive. Fat being your own tissue, it's easily accepted in the body. The results are very natural and there is no limit to the amount of volume you can get with fat because it's your own tissue.
I know you have this micro, this is detailed stuff.
Because we use these micro cannulae, there is hardly any bruising, you don't end up with any marks on the face, and the result is very natural. I mean,
For the cheek implants, you go for malar over submalar?
Again, it depends on the type of facial structure that a person has.
The difference between malar and submalar, ethnic, personal preference, what is it? What's the...
Yeah, I mean, it depends on the kind of facial structure that one has. If you really need to have high cheekbones, then it's a malar implant. If somebody has like sagging on the cheeks and you need more volume on the lower part of the mid face, then we can go for a submalar implant.
Any problems that could arise once a patient returns home to their own country, and what would they do?
See, normally in order to make sure that you are fit and fine before you fly back home, I suggest to all the patients that you finish the last bit of your surgery at least a week or 10 days before you are about to fly back, so that you get adequate time to recover. I get adequate time to ensure that your healing is happening fine, there is no infection, your stitches are doing fine. Whatever infection you are going to have or whatever healing issues you are going to have, normally they should be, we should be able to know within the first week or 10 days. Once your stitches are healing fine and then you just have to maintain good hygiene at home. Nothing happens.
So as long as the patient's aware of keeping things clean, observing it, then any problems are going to be superficial because the major healing's already started within the first 10 days.
Any problem that you anytime have, I always tell all my patients, I'm always ready to talk to you on Skype. The first thing you should do is always meet your local GP, and we can be in touch with your doctors back home. In case of any emergency, I'm always a phone call away.
A patient comes for FFS and it's an extreme, they want full-on FFS, make me total male,
Like Jane Watson.
make me totally female,
I know the feeling.
Anybody comes in complete admiration from, because it's a massive change. And if anybody wants full-on FFS, there are steps to take. And there are things that I know that you made me do. If it's going to be that big of a change, what are those steps that you require?
See, by and large for an FFS, we don't need any independent psychiatrist to evaluate you. It's only if you're going to have an SRS that you need to be evaluated by
So
science.
genital surgery, we need the certificate.
Yes.
Facial surgery, we don't.
No. For
However-
facial surgeries, some countries are very strict in terms of the facial appearance. So it really depends on which country you are from. If your country depends on the retina scan or your fingerprints to give you access for your flight back home, then it's not a problem. If they are going to see your before and after photos, then they might have a little bit of issue. So we always issue a letter for all our patients saying that such and such person has done a facial feminization surgery. Their look is going to be slightly different compared to what it might look on the previous passport. But by and large, they don't create any problem if you have a letter from me.
Getting out of the country was difficult. I didn't look like my passport. And all the paperwork that you gave me to get out of the country, it helped a lot. I was able to verify who I was and what I'd been through. I think we wrote to the embassy as well, didn't we? And we got everything because it was going to be dramatic, and you knew the way we talked at the initial, you knew it was going to be big.
Yeah, we can always issue a letter for the embassy and it's not a big thing.
But you don't need any psychiatrist letters or any letters from your own clinic.
Not for the FFS.
Not for FFS, there's no hormone requirement, there's no... So people can, your FFS
Yeah,
could be...
because see, FFS is not a surgery which needs you to be bedridden. You are practically walking about like normal the second day. So having a long flight back home is not too much of an issue, because it's a facial surgery. It's not your body which is involved.
Thank you for joining me on the sofa today. It's been a nice little chat. I'm sure you all have lots more questions, and please feel free to ask, and maybe we'll get Dr. Telang back on the sofa and we'll go through some more. Thank you for your time.